Hi there and welcome. I'm so glad that you're here to learn more about using core assessments to gauge a pet's well being. This presentation is designed to bolster a pet guardian's confidence in caregiving and collaborating with the veterinary interdisciplinary team for better outcomes in palliative hospice and end of life care. I'm going to be doing that by helping you understand how to do a basic assessment, how to identify pain, nausea, and other common symptoms and signs of trouble. Having confidence in these areas really improves the caregiving experience and the pet's physical, emotional, and mental comfort, as well as the human animal bond, supporting that. The most important aspect of this very tender time of life with a pet. And you might wonder, what makes me qualified to speak on this topic? My name is Lorrie Shaw, and I'm a 20 plus year veteran of the pet care industry, with the last decade of that time spent focused on animal palliative and hospice care. I am Chief Experience Officer with Telos Companion Animal Services, LLC, where my practice is focused on working with families as they move through progressive or life limiting diagnoses of their pet, age related decline, as well as palliative hospice and end of life care. I'm a certified animal hospice practitioner, certified hospice and palliative care advocate, and certified fear-free professional. I'm also a certified professional pet sitter, and for as long as I've been in the industry, I've held the certification in animal first aid, and that's been updated at least every 3 years and is consistent with the industry guidelines. And you might notice that as we move through this presentation, that much of what I'm going to talk about is grounded in that training. And you would be right. Many families have noted that the guidance in this presentation has been critical in hurdling what has been one of the most common and challenging aspects of caring for aging pets and those with progressive or life-limiting diagnoses. Understanding to a greater degree what is happening or not happening with their pet. Assessing and understanding a pet's quality of well-being is vital, though a decreased quality of well-being is a natural prompt for the conversation about euthanasia care being opened up, sometimes prematurely. And so it's important to me to shed light on some nuances on this very important topic. And this presentation is designed for pet guardians who are facing a pet's progressive or life-limiting diagnosis, families who want to be better prepared in the event of that, as well as age-related decline, and veterinary interdisciplinary team members who are not on the core vet team, people like pet sitters, dog walkers, canine massage therapists, and groomers. And so when these assessments are done matters. Doing them regularly is critical to a pet guardian's mastery of caring for a pet with changing needs. And when they begin practicing how to do that early, their sense of mastery is better. Reassessments during these turbulent times helps gauge how well changes to any treatment or comfort care plan are helping. And these assessments, when done consistently over time, they help track a pet's progression with a diagnosis or through age-related decline. Why? Well, being able to do this serves several purposes, including helping to assess and improve a pet's sense of comfort and well-being, identifying gaps in caregiving, and developing these skills also helps promote a sense of mastery in caregiving, especially when used in tandem with quality of well-being assessment scales, pain assessment scales, and grimace scales, because they allow everything to be brought together in a cohesive way to communicate with the rest of the IDT. Caregivers can be better positioned to understand when the vet has labeled and dispensed a pain or nausea medication that is to be used as needed, knowing when as needed is. Something that I see far too often in my practice as being confusing for caregivers, and rightfully so. Unfortunately, many vet teams don't clarify when as needed looks like, and so I'll be helping you to identify that in this presentation. These skills have been in my toolbox for many years as a certified professional pet sitter and certified fear-free professional. And with my focus on palliative hospice and end-of-life care support, they get daily use in my practice, no matter a pet's health status. It tells me if they're having trouble, but more importantly, that they're doing well, which is often the case. And I can say that pain and nausea are two of the most common triggers for a caregiver's concern or a pet having trouble managing their comfort. They can often be a trigger for behavioral changes, including appetite, a willingness to eat, which are two different things, a desire to engage with others or to be touched, increasing anxiousness or new anxiousness with a pet, or their ability to perform activities of daily living. And because of that, those are going to be the focus of my presentation, though there are other key areas like assessing breathing and other vital signs and aspects of comfort that you can learn to assess more confidently. And understanding other vitals and features that can impact a pet's overall well-being can help pet caregivers adjust to do what they need to do to help their pet pivot more easily as well and to adapt. Families report that having this knowledge under their belt has really bolstered their sense of mastery and caregiving. And since it reduces the anxiety because they're not playing guessing games about what they're observing their pet doing. And they can better collaborate with veterinary interdisciplinary teams more effectively, which can expedite the process of sorting out any next steps when there's a problem. And so in our time together during this presentation, you're going to learn to be more savvy in assessing discomforts, pain, nausea, by using objective data, subjective data, and learning the signs that are typically associated with them. And then we're going to explore other ways that you can assess your pet in meaningful ways. And I should say that in assessing any symptoms, discomforts, or pain, it's important that we shed any biases about what we determine as uncomfortable to painful or how a pain affects a pet. They're the ones who get to decide how they're interpreting, expressing, and experiencing physical discomfort, pain, and other symptoms. So just to clarify, subjective refers to the information a patient, in this case a pet, what they tell you about how they feel, which is based on their personal perception and experience, while the objective is data that is information that can be directly observed and measured by either a caregiver or a veterinary interdisciplinary team member. And so we're going to dive in on how to do that. We're going to start with nausea. Nausea is one of the most pervasive problems that I face in my practice because it's very, very common, first of all. And it's one of the most underrated, addressed concerns. It's nebulous, first of all. And so to everyone's credit, it can just be really tricky. And so I do call it the cloaked culprit of choppy waters with pets. There's a lot of reasons why. And I can say that when I first connect with a family on a concierge plan to support them through hospice and palliative care and end of life, whether that is in person or remotely, that it's the first thing I focus on. I get the electronic medical record back from the vet, and I get the paperwork that I have the family fill out that really tells me a lot about what the pet's experiencing. And I review all the information, and I can usually see a pattern emerge. And so almost always there's nausea present to some degree. In some cases, it's the top problem. And so a family will report that their pet's appetite is not where it needs to be. They really have trouble getting them to eat reliably and consistently. They've been back to the vet or they've had the house call vet come a number of times. And so in some cases, the vet has prescribed nausea medication and they will direct when to use it immediately. And then they just say, give it as needed. Sometimes it's not in either case. And so as the family and I connect with our first consultation and we go over the paperwork and we review these symptoms, they say, oh yeah, they're doing that. Oh yeah, I recognize that. Oh, I get it. That's nausea? Yes. And so the following symptoms, and I don't think this is really an exhaustive list. I've learned that nausea can be really super confusing and broad, let's put it that way, not so much confusing, but broad. Every pet's different. And so they may experience restlessness, panting, drooling, shaking, or trembling. Most times I'm hearing families recognize immediately the repeated swallowing or gulping of air, the lip licking, the lip smacking. In some cases, a cat will have a hunched posture, a pet might retch. Either species might experience signs of stress or nervousness or increased anxiety. They might vocalize. For dogs, they might whimper or whine. They might bark sometimes. With cats, we tend to see that they'll howl quite a bit for no apparent reason. In both species, we'll see that they show interest in food, but they're not eating. They might seem like they want food, but they turn their head away at the last minute, like they're kind of disgusted, or they might refuse food altogether. And so these are not an exhaustive list, and pets do not need to be experiencing all of these symptoms, mind you. Um, and what I will say is to a family when they tell me this, and I say, okay, I see that you have these anti-nausea meds have been dispensed to you. When's the last time that you've given them? And they're like, oh, it's been a long time. I didn't see that it was necessary because my pet wasn't vomiting. And so I need to point out that vomiting need not be present if a pet is nauseous. And so it often isn't, right? In some cases, a pet doesn't even have any food in their stomach because they've been so nauseous that they haven't wanted to eat for a period of time. And so I will tell them, if you have them on board, this is the time to give them. Let's give it a go. Let's see what happens. And then lo and behold, the pet starts eating after a dose or two. If the nausea meds are not on board, then I ask the family to connect with the vet to have a conversation about the symptoms that they're seeing, talk about our conversation, and then next steps about maybe perhaps trialing some anti-nausea meds at home and seeing what happens. In some cases, they need to go into the vet or have the house call vet come and do an injection first to get things kind of boosted, and things get on track. But one of the things I want to point out, in addition to vomiting not needing to be present with nausea, is that pain can trigger nausea. And that's also one of the underlying currents of this. And so we're going to talk about that next. So pain is a complex issue. There are different types of pain, different sources of it, whether it's acute or chronic, or as it's also called, maladaptive pain. And of course, the pet's telos comes into play, their individuality, what makes them who they are. And we're going to have a look at the two different categories of pain first. And we're going to start with acute pain. That's usually the one that's most recognizable to people because it's top of mind after an injury or surgery or maybe a diagnosis like pancreatitis, which can be really painful. And so that's top of mind for families because typically they've already had a visit or a hospital stay and the pet's been sent home and they're on pain meds and the vet team have told them what to look for and how long to give the pain medication or how to pivot. And so the thing is with, the acute pain, it's usually associated with post-surgical pain, an injury, pancreatitis, an infection sometimes or an inflammatory process. And of course, it's associated, with a temporary situation, right? The acute pain serves a biological self-limiting purpose during that healing process. And it can range from mild to severe, of course, and it can last a few hours or a few days. And so it's generally well managed with pain medications too. And doctors are really excellent at anticipating how a recovery will go and what steps to take. And so it usually goes really well. And so chronic pain, the thing that we're going to be talking about on the right side of the screen, or maladaptive pain, looks a lot different. And it's usually associated with osteoarthritis or degenerative joint disease. By its nature, chronic pain is more complex and nebulous. It's associated with joint pain, soft tissue pain, nerve pain, which can also be associated with osteoarthritis in more advanced cases that are untreated or undertreated. Visceral pain can be present like that in the GI tract and the belly. The ever undervalued mouth pain. We see that frequently with these older pets. They've got bad teeth and gums that need addressing. They can have eye pain. Eye pain is extremely pervasive with pets, and it goes, I don't think it's valued all that much, but it can be really painful, as well as ear pain and other common sources of chronic pain. Though I will say that to clarify, some of these can actually fall under the acute category, which illustrates one way that it can be more complex. And honestly, chronic pain is a lot more difficult for caregivers to pick up on, right? Because it kind of creeps in. And unlike acute pain, chronic pain persists beyond the duration of tissue healing. And there's no clear biological purpose or endpoint for it. It's commonly associated with those chronic diseases like osteoarthritis and degenerative joint disease and sometimes the nerve pain that accompanies that. And so without management, sadly, it can lead to hypersensitivity and causing pain sensations to spread beyond the injury site and significantly diminish the quality of well-being. And so we're going to take a look at what to look for, which is, again, a combination of objective and subjective data, which really illustrates the need for really good quality of well-being assessment tools, pain assessment scales, and grimace scales. Let's have a look at this. And so pets can express signs of pain differently depending on their breed, their individuality, their age, even the chronicity of the pain. And so they can have behavioral changes due to pain that often develop gradually. So being aware of your pet's daily habits is key, really, as these subtle behavioral cues are going to be more readily detected by someone who's most familiar with the pet. That's you. And so it seems important to point out that even when a pet is known to experience maladaptive or the chronic pain, acute pain can arise quickly for various reasons. And so going back to working with families in a concierge plan, one of the conversations that we have is with an emergency crisis kit, and that can involve pain medications to address that acute pain that can surge unexpectedly. So I do have a separate presentation on that specifically in end-of-life care. And so you can learn more there, but it is one of the conversations I have because it can happen. And so some changes to look for that can indicate pain in both categories. Changes in mobility. We have altered posture, where a pet might sit or lie down more often or hold their back in an arched position. They can carry their head low, or they can carry and position their tail abnormally. You'll notice that. It's a sign. They can be stiff or limp. They may favor a limb or exhibit difficulty walking. In fact, sometimes I see when I'm with a dog, especially in a leash, and I see them kind of like hitching their head over a little bit. That can signify some shoulder pain or some lower upper leg pain in that joint area. And it's a conversation, of course, with the family and the vet to get that sussed out. But that's one thing that you can look for. They can also have trouble moving, like difficulty sitting. And I can say that I never ask any of my senior or geriatric dogs that I take care of to sit. And if I am accompanying them at the vet clinic and they ask for a sit from the dog, I step in immediately and advocate for them, because the one thing that we don't want is for a pet to be subjected to more pain than they need to be. And especially when they're in an exam room where it's tight quarters and they're being handled, we want to keep things safe. And as a fear-free certified professional, that is absolutely paramount for me. We can also notice that pets have a hard time getting up from a resting position, whether that is sitting or in a recumbent position. And of course, we see those dogs and cats get up rather slowly. They might groan a little bit, make some minor vocalizations. And yeah, it's pretty noticeable. It's one of the first things that families see. We also might notice that pets are not getting up on the furniture, whether that's a couch or the bed, as much as they used to, if at all. And cats, they might not be jumping on the counter anymore, or as often. They might not be getting up on that favored perch by a window that they like to look out of, or even a cat tree. And so those are some signs. It changes in activity level. They can become restless. They can pace or have that inability to settle. A lot of families associate that with just having too much energy at night, or they have cognitive issues, and it's typically related to pain. It can, of course, involve other disease processes and different diagnoses, but I always encourage families to talk with their vet and explore pain first. They can be lethargic. A dog or cat might seem unusually tired or unwilling to move. Sometimes that's because they've had lack of sleep because they've been so uncomfortable, or they just find it easier to sleep more. It's more comfortable. They're not aware of the pain. They can have a reluctance to exercise and move. They might walk more slowly. They might have some hesitancy in engaging in things that they used to do. A lot of families report that their pet is willful, or they just are lazy or whatever. And again, I come back to the conversation about pain. They can experience appetite changes, including dysrexia, or disrupted appetite, hyporexia, decreased appetite, anorexia, absent appetite. I do have a separate presentation specifically on appetite changes, and I talk more about how pain can impact that and things to try and things to look out for and how we can assess that from an appetite perspective. And so I invite you to look at that. Pets can also experience altered sleeping or resting patterns. They might sleep more, as I said, or they just can't get comfortable and they're trying to sleep. Um, we often find that pets will bed hop, as I call it. They might go from bed to bed to bed or space to space in the house. And I don't mean the type of behavior that they may have had previously, where they kind of chase the sun through the house in the daytime. A lot of families are noticing that more now that there's a lot more work from home arrangements. I'm talking about a pet that is really trying to get comfortable and it's getting frustrated. And a lot of times you will also see that accompanied by them scratching at the flooring or the bed in an excessive way. And that's because they're sore and they're painful and they're trying to get comfortable. They also might start having elimination issues in the house. Now, granted, there's some pets that have always done their business in the house occasionally. They typically pick an area and they will do that. Um, and if you see them doing that in different parts of the house, or that's a new presentation, or if your cat is urinating or defecating outside the box, it's a lot of times associated with pain. And so I ask families to get with their vet and talk about that in those cases. And we're going to talk about some more signs here. Behavioral changes can definitely accompany, be a part of signs and symptoms of pain. Vocalizations come to mind, the whimpering, the yelping, the groaning. Um, Cats can howl more often if they're in pain. And again, it doesn't have to be associated with osteoarthritis or joint disease. It can be other sources of pain too. And let me just say that osteoarthritis isn't just in the hips. It can also be anywhere in the body. If you have joints, you can have arthritis anywhere. And so I will say too that with vocalizations, a lot of people associate that, oh, well, that's when I know my pet's in pain. No, 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 not necessarily. In fact, chronic pain is far less common with vocalizations, or I should say, vocalizations are far less common with that, with chronic pain, especially when we're talking about osteoarthritis or degenerative joint disease. Though I will say that in cases where the pain has not been addressed appropriately for a long period of time, you're gonna start seeing some vocalizations. And when that's the case, let me just say that it's bad. Okay, dogs and cats don't complain; they adapt. They're not like us where we complain at the least little thing. Sometimes they just don't do that. Their first strategy is just to adapt and cope until they can't anymore. And this is a scenario where they've exhausted all their coping tools. We don't want that. And so they can also withdraw socially. They can hide or avoid interactions. It's definitely noticeable with dogs and cats that are really upfront about doing so typically, and then they suddenly drop off a bit on that. They can also develop anxiousness or increased anxiousness. They can be more needy, seek more attention and affection than usual. A lot of families report to me that they're suddenly very excited and happy that their cat, especially, has decided to come out and start interacting with them when they have never done that. And they see it as a positive thing. And then I say, that's kind of a red flag for me, because a behavior change always means something. So in this case, I always think it is deserving of assessing pain with the veterinarian. They can also be sensitive to reactions to touch, like a dog that is normally really affectionate or a cat that's affectionate can now react negatively to being touched or held or even approached. And that can also be exacerbated by any visual or hearing deficits that are occurring. And so they can also excessively groom. They can lick or chew at a body part, usually the paws, stuff like that. They can lick their arms. And that's really just like the same thing that we do if we're injured. Say if we hurt our arm and we rub it, they're doing the same thing. They're trying to assuage that pain the best way they know how. It's an adaptation mechanism. A lot of people associate that with allergies. And it's a really popular thing today, especially with all the holistic things on the market. I always say, go back and talk to the doctor about pain first. They can become irritable or aggressive, and they can have uncharacteristic snapping or growling or any kind of behavior that signifies that. And that's especially concerning when we have pets, like I often do in my care, who've had a history of behavioral challenges, including aggression or fear aggression. Those pets typically have, and it's not just limited to dogs, cats can fall in this category too, where they develop this pain and it goes unchecked. they have a much shorter threshold for stuff like this. And so they can actually experience pain a lot more sensitively than other pets would. So we need to be extremely thoughtful about them. Again, as a fear-free certified professional, it's something that's top of mind for me. And my interactions are always driven to be very safe for both parties. They can pant excessively, even when they're at rest, especially if they're doing it at a time that seems inappropriate or uncharacteristic of when they should be doing it. A lot of families report that it's done at night. Why? Because it's waking them up. It's impacting their quality of well-being. And so a lot of times they do associate it with cognitive decline, and it's anxiety. It could be, but I think it's always important to convene with the vet and double check that pain status and reevaluate it. And it should be reevaluated frequently. Pain's complex, as you're noticing. And then at the very bottom of that white quadrant of the slide, facial expression changes. We can see a change in expression, things like flattened ears, grimacing, or glazed eyes. And this brings me to another important point, in that the use of pain scales and grimace scales are available, and quality of well-being scales. And those can be really useful in assessing the body language and the facial expressions. And that's in conjunction. You can go to the fearfree.com website, Fearfree Pets, and they have lots of free resources there to look at canine and feline body language and other species. I want to include everybody here. And so that can be really helpful. So using the importance of using pain scales really comes to mind, because it boosts the ability of everyone involved in the IDT, including the family, to assess discomfort and pain in an accurate way, and communicating the subjective and objective observations to other members of the vet IDT, including the vet, the person who can help you the most and should be involved. And so there are pain scales available for both dogs and cats and other species, available for free download on my website, lorrieshaw.com, which includes the Colorado State University Canine Acute Pain Scale. There's also one for felines. Now, this is suited for acute pain, right? This is what they use in the hospital. And it's not suited for chronic pain so much. But what I will say is that it's great because it gives you the illustrations to look for and the signs. And so I don't think they're bad necessarily for chronic pain. I think they can help you get really accustomed and more proficient at reading it. And so there's also the canine and feline brief pain inventory available, and the grimace scales for felines, rabbits, rats, mice, and horses. Now, those are all available on lorrieshaw.com for free download again. So you can print those out, look at them, get to know them. It can be really helpful. Grimace scales are really helpful because they can assist caregivers in honing in on those really subtle cues in an animal's facial expressions. They really speak volumes. And with some practice, you can look at a companion animal and quickly assess their comfort level by how they're holding their body and their facial expression, along with their behavior. In fact, after so many years of doing this, I can easily assess a pet by looking at a photograph to see if they're in pain. In fact, one professional peer had contacted me years ago after the dog that they were fostering had been released from the hospital after a couple of days after sustaining an injury. And when they had come home, the vet team had decided to discharge them because they were doing fine, but their appetite wasn't so great, and they suspected it was just because, they might do better at home. And it turns out that wasn't the case. And so my friend was trying to suss out what was going on. She knew I knew a lot about this and might be able to be of help. And they asked what to do. And I gave them a couple of suggestions and got curious about, I don't know anything about the discharge report or what they had sent home for the management plan. So let me know what that is. And in the meantime, she had sent me a photograph of the dog, and I went, oh, wow, they are really, really miserable. Their face said it all, their body language and everything. And I said, they're in pain. They're like, how do you know? And I go, this is why. I can tell from the picture. And I explained all of it. And so they had gotten back in touch with the vet to reassess. And as it turns out, the pain management regimen was just not appropriate enough. It needed some extra boosting. And so I'm happy to say that within 3 hours of that pain medication getting on board and getting things under control, the dog was eating reliably again. And so it's just one example, but Again, looking at those grimace scales and the body language and getting more proficient at that can really be helpful. And those resources are all free. There's no gatekeeping there. We're going to move on to a different level of assessing a pet's well-being, and that is their breathing and respiratory rate. It's really helpful, and it's a skill that I use frequently. And the observations that I make help me understand whether a pet in my care is managing well or not in many ways. And it can signal trouble, especially if the dog or cat has a heart condition or an airway issue like geriatric onset laryngeal paralysis with polyneuropathy or asthma, metastatic cancer, especially if there is ascites present in later stages of cancer. It can also signal if a pet is experiencing increased pain or distress. In fact, a lot of things. And so we really need to take that seriously. The science can't be hidden. This is all strictly objective data, which is great because once you understand how to do this assessment, there's no guesswork. Like you're going to get the numbers and you're going to go, okay, I see how they're breathing. That makes sense. This tells me this tells me that. So the signs of respiratory distress in a pet can be rapid or shallow breathing, an abnormal wheezing or coughing. Now, coughing and wheezing is not normal in cats and dogs or any species. Though, dogs and cats can have allergies, and so they might have a little bit of a dry cough. If that's something that you're used to hearing them and you know what that sounds like, I'm not talking about that. I'm talking about that congested, when they get up from a nap or get up in the morning and they cough, that's not a good sign. That typically tells me that they're in the later stages of like congestive heart failure. So we see that with like heart patients um, and that sort of thing. They can have labored breathing, which is characterized by that visible effort or discomfort when they're breathing, a lot of belly breathing. So that really noticeable in and out and in and out in a complete breathing pattern. They can have nasal discharge or some sneezing. If they have a bluish tint to their gums or tongue, that's not anything to play around with. It indicates that they have a lack of oxygen or hypoxia, and that needs immediate emergency medical attention. They can be lethargic or lack of appetite. One thing that comes to mind for me when I see that are cats who, again, may not be as amenable to hanging out with their family. They don't really like a lot of contact. If somebody comes in the room or sits on the couch, they leave, they move. If they don't do that, it's definitely something to look at. Now, dogs can do this kind of thing too in different degrees. But one thing that comes to mind is I've had a couple of families of record who have gotten in touch and said, hey, we just wanted to let you know. We wanted to ask you some questions. So this happened. We went into the living room and went to sit on the couch, and the cat did not move, which we were really delighted about first because they've never wanted to interact with us necessarily in a way that we like, the way that we expect a cat wanting to do that. And we've always accepted that. But when we sat down, they didn't move. And then we thought, oh, this doesn't feel right. I said, you're absolutely correct. That's a red flag. It's a sign. It's a symptom. And they were going to go to the vet, both cases. And I said, while you're there, I want you to tell the vet team exactly what you've told me, that they seem lethargic. They're having a little bit of trouble breathing or a lot of trouble breathing, and they didn't get up and move. I don't think enough vet teams take that latter thing seriously by a change in behavior. And so in both cases, the cats had developed congestive heart failure due to a congenital defect. And it wasn't anything that anybody missed. These things tend to come on very suddenly. They can seem quite healthy and normal one day, and then the next day they're in really bad shape. And so they did require humane euthanasia. But again, that is a signal. That's a change in behavior. So look out for that. They can also, cats, they can have this upright, tense posture when they're trying to breathe. They're just doing anything they can to make space to breathe. And in cats, they can also paw at the neck. That's something that we don't see as often, but it can happen. And what they're trying to do is they're like, this is a problem. This doesn't feel right. I can't get any air. And so if you see that, it's not funny. It's definitely something that needs immediate attention. And so to accurately measure a pet's respiratory rate, it can seem challenging at first, but with the right technique and practice, it becomes really simple. And the thing is that you don't need to touch your pet. You don't need any real special tools. You don't need to like do anything medical. It's all about observing, counting, and documenting. So you do need a stopwatch. I use my iPhone, which has the clock feature and the stopwatch feature on it, so that works out great. And so after I do daily assessments of all the pets in my care. After I do their assessment and I record their respiratory rate right in my phone, so it makes it real easy. Everything's in one place. So you want to start by being in a quiet, comfortable space where the pet feels nice and relaxed and they're quiet. Avoid any distracting noises or activities that can cause any stress or distractions for the pet. And I do this daily, like I said, so I just wait for the pet to get in a nice, comfy spot. They're not paying any attention to anything in particular, including me. They're just chilling out. And I take that opportunity to just observe them. Of course, I don't do any handling unnecessarily, no restraint, because that can skew the respiratory rate. We see that often in vet clinics, right? And so I just watch their breathing for 1 minute and I focus on the chest and the abdomen rising and falling. So I count the number of complete breaths, that is the exhalation, the inhalation, exhalation. That's one complete breath. Take 1 minute and do that. And then I typically repeat that 3 times just for accuracy. And so I take the average of those recorded respiratory rates, and that is my final, right? And so it's also fine to track that for 30 seconds and then multiply that by 2. So just watch the breath for 30 seconds, multiply it by 2 and record it. There you go. And so there's at the bottom of the right quadrant of the screen there, you're going to find the normal respiratory rates for dogs, which is 10 to 30 breaths a minute. Smaller breeds are at the higher end because they're smaller. Larger breeds have a lower rate, so they're going to be at the lower end, right? Cats usually have a respiratory rate of 20 to 30 breaths per minute. And then small mammals like rabbits and guinea pigs, they generally have higher respiratory rates compared to dogs and cats, and that can range anywhere between 30 and 60 breaths a minute. Birds have a very unique respiratory tract system, and that can range anywhere between 20 and 60 breaths per minute, depending on their species. And so, again, signs of trouble breathing are all an emergency. It can be part of the disease process. It can be pain. It can be a lot of things. And so make no mistake, they need to get into the vet immediately. If your primary vet is not immediately available to assess them, they need to get to an emergency vet hospital or an urgent care. So with that, we're going to move on to a different way of assessing a pet. And probably one of my most favorite ways because I get instant data right back, and I love this. And so we're going to talk about mucous membranes and capillary refill time. And so the mucous membranes are the tissues that line the body cavities, such as the mouth, which is where we're going to be focusing our attention here. The appearance of these membranes can tell us a lot about circulation in the blood, oxygenation, hydration, and other aspects of their health. In a healthy pet, those membranes are pink, what I like to call peach petal pink, or the color of cooked shrimp. And they're moist, ideally. And so when these membranes become pale or discolored, and I'm going to detail what discolored means in just a couple of minutes, this can be a sign of a serious medical condition. And so the easiest membranes to evaluate are inside a pet's mouth, in the gums and the inner cheek area. And so some breeds of dog and the occasional cat can have really dark or pigmented gums, which really makes coloration assessment difficult or impossible to evaluate. But there are other areas to do that. And so this is also important if you have a dog. And I'm sure that there's some of you out there who say, my dog does not like to be handled, or they don't like their mouth being touched and they get really aggressive. Well, not to worry. There's other places to look for their coloration. You can look at the inner part of the eyelids to see there's some redness there, some pink, and that should be consistently colored. The ear pinna is a good place to look. Is often where I look, just to make it easy. Just flip that ear back and see what it looks like. Or if you have a German Shepherd, they stand up, and they're really easy to see. The belly, where the fur is most sparse, is also another area that's easy to check, and that's often where I look, especially with dogs and cats who don't like to be handled. And in females, you can look at the vulva. That's an available area too. And so I should note that if checking these areas to assess color, please do so. If you live in a cold climate, do so after the pet comes indoors and they have a chance to warm up. The cold temperatures can tend to restrict that blood flow and it can make things look more pale than they should. So just let them come in and warm up for a while before proceeding to do that. You're not going to get an accurate assessment otherwise. And so those membranes, they should be slick. They should not be sticky. If they're sticky, that usually, well, it does mean that they're dehydrated. And so, after some practice, you're going to get a lot better at this. And so, if you don't get it right at first, just keep trying. It gets better with practice. And so, one thing I want to say is there's an old wives' tale that if you just check your dog's nose and touch it, and if it feels a certain way, then they're good. No, don't do that. It doesn't make any sense. It's not true. Just check the gum tissue. You're going to get a much more accurate evaluation. And so the point of observing these membranes is not for you to make a diagnosis. It's for you to help assess what's going on and how urgent things are. And it can be really helpful as you're learning how to do this to, when you're practicing, take a picture of your pet's mucous membranes and their gums and stuff and get a feel for what that should feel like and look like. And take photos of them on your phone, because when they're feeling fine, and if at a time you go to assess them and you're not sure if they look different, take a picture of that. You can compare the two. When you're nervous, that can really come in handy, because then your mind doesn't start racing around and you think, wait, is there something wrong? So I hope that helps. But it's really nice to get used to doing it and knowing what it looks like at baseline, so that you know when they look okay. And more importantly, when things don't look right. Also, dogs and cats, their membranes can look a little different. Cats can be a bit more pale than dogs. And so if that's the case, don't get freaked out. And then, of course, we're going to talk about what to look for in terms of the color. And so I want to say that dogs with poor dental health, they might have bright red irritated gum tissue at the base of their teeth, like where the teeth meet the gums. And so as you're evaluating their mouths, just don't focus in on the one area. Look at the appearance overall. You're going to get a much more accurate assessment. The same is true for puppies when they're teething, because their teeth are going to fall out and they've got some irritated gums. And so, again, just look at the overall appearance. And so we're going to talk about the rainbow that we can see with gums. And I've seen them all. If the gums are inflamed, slightly red, that means gingivitis or an oral infection. And for goodness sake, if this is the case with your pet and their breath stinks, it's not going to go away. I'm recording this in February. It is Pet Dental Health Month, and I'm a big believer in dentals. You can't go wrong with those. They're going to keep your pet extra healthy overall, and they're going to be a lot more comfortable. I actually had written a piece on the benefits of those, especially as a pet ages. And so know that that is a serious thing. It's not an emergency. It can be if it's infected, but it's not normal. Also, if their gums are cherry red, that's not normal either. They can have a toxin that they've gotten into. They can have heat stroke or even high blood pressure. If the pet's gums are yellow, or what the vet team calls jaundiced, it can be a sign of liver disease or an immune-mediated process. If they're gray, blue, or purple tinged, again, that's not good. It's not where you want to be in the rainbow. You want to be that peach petal pink. So if it's gray, blue, or purple tinged, it means hypoxia. That means that the pet doesn't have good circulation and they have decreased oxygenation. Typically seen with heart disease, severe hypothermia, low blood pressure, or a respiratory or airway issue, again, like the gulp, asthma, stuff like that. Also, if you ever observe any tiny pinpoints or like red or purple spots on the mucous membranes, this is called petechia, and it's a serious finding that needs to be addressed immediately. They may be clustered closely together or spread across a wide area, both on the gums and the inner cheeks. If you find petechia, do not delay getting to your vet. Call them what's going on, and then proceed accordingly. We're going to move on to the right side of the screen to probably my favorite assessment. I love this because I get feedback so fast and it tells me so much. And most of the time, I get the response that I want. And so we're going to talk about capillary refill time, or CRT. And if you have ever read over a discharge report after your pet has come home from the vet, you might have noticed that there's a detail on the sheet that says CRT, and then it has a value of less than 2 next to it. And what this means is that the vet team has assessed that the pet's capillary refill time, and in this case, has a value of less than 2. That means it's less than 2 seconds, which is what we want to see. It's exciting. And the reason that this is so important is that the CRT tells us that the pet's perfusion, or the process of the blood and the other fluids moving through the body's circulatory system to the organs and tissues, is adequate. And so we think of things like blood circulation, oxygenation, blood cells performing the way that they're supposed to, stuff like that. Capillary refill time is another essential vital sign to assess. And just like the others, it takes a little time to get practice with. And so to check the CRT, it's really easy. And so what you want to do is press your finger firmly on the gum tissue, again, the pink part, for about 3 seconds, and then release that pressure. And then you'll see an area that's a bit more pale than the surrounding tissue, but that color should turn back to that nice peach petal pink, or that shrimp color, within 2 seconds. If that is delayed or absent, if it's delayed more than 2 seconds, or if it's absent, that's an emergency. That can mean several things like impaired circulation, anemia, dehydration, even shock. It can mean a gut bleed. There you have internal bleeding someplace, some kinds. So nothing to wait on. You can test this on yourself to kind of get some gauge on what that should look like, or what how it goes. And so you can just take your thumb and press it onto your hand, and you'll see that white area emerge, and then it should disappear within 2 seconds. Hopefully it does. If it doesn't, you need to get to the hospital. And so that's a great way to test it. But yeah, just practice. You'll get better at it, and it's a really great assessment to have on hand. And again, if this is delayed or absent, it is a veterinary emergency. It's not a wait-and-see situation. And we're going to talk about next steps after you do these assessments and you find things that don't seem quite right or are clearly not good. And so if after evaluating that pain or nausea or these other symptoms or values, they're not within normal limits, you need to contact your vet. Before the appointment, ideally, you want to try to document, if we're talking about pain or the signs of unwellness, document their behavior. Take photos of what they're doing. Videos are really helpful, especially since dogs and cats can get kind of stressed out when they see the vet. Take your written notes and logs to the vet, including those quality of well-being assessments, the pain assessment scales, the grimace scales. It's a common language that you can share with the vet. They can read it and they go, oh, wow, you really have done your due diligence here, and this is really helpful. It can expedite things really fast. And so you really improve those critical insights that the vet needs. And so what you can expect when this is the case is that the vet will do a thorough physical exam, and then they're going to decide from there any necessary tests. Now, most of the time, I find, and the vet can decide this at their discretion, blood work is typically indicated. It can tell a lot. Urinalysis in some cases. Sometimes they recommend x-rays after they do those things and they get some more data. They might even say ultrasound would be a good idea depending on the clinic, and other diagnostics that can be really helpful. Again, this is not a money grab. I've said this in the past in other presentations and when talking with families. It's due diligence, and they need this data to be able to decide what information is going to help them get to the bottom of what's going on so that your pet can be stabilized or feel better, or you can have bigger conversations if necessary. Again, these assessments that we've talked about are not a replacement for medical care. That needs to be done by the vet. These are only tools to help you identify when that is necessary. Okay. So again, get used to doing these assessments. Use them in tandem with the quality of well-being assessment tools like the Telos quality of well-being assessment tool, the pain assessment scales, the grimace scales. Can actually help you assess things much better. It can put your mind at ease, and it can help you effectively communicate with the rest of the veterinary interdisciplinary team. And so I'm really grateful that you have joined today. We're going to wind things down here. I do welcome your contact. You can reach me best at my email address, and that is ppsa2mi@gmail.com. And my website at lorrieshaw.com is where you can find all the downloads for those assessment scales and resources otherwise, which are all free. And if you are interested in working with me, whether it's in person or remotely, you can find me there and we can get the ball rolling on that. I do wish you the very best of luck in your endeavors in caring for your pet in this stage of life. It's not easy, but I hope that you found this helpful and that it makes that much easier. Thanks again for joining today.